Okay, now let's go over to the issue of nursing school. I remember that particular issue caused so many controversies here in the state. Students came here. In fact, here became a kind of a looter ground where they will always come to protest, with the issue of intake and all that. What has happened so far? I remember that the council, Nursing and Midwifery Council of Nigeria, stepped in and asked the Abia State government to hold on, do not do anything. Has that issue been resolved?
Yes, it has, Leneka. Thank you for asking that question. It has. We have quietly resolved it, and everybody's back in school. The students that passed the exams are all in school now, and things are okay.
Okay, so what did you actually try to find out what happened? Because we must make sure that it doesn't happen in the future.
So these were the things we met on ground. They'll go to the panel. Okay. The investigations are on, and the necessary, the culprits will go to the panel. Provisions were made for 75 students to be admitted into the schools, and we met 485. One, you don't even have the classroom to take this many people.
Who collected?
This was the admission that happened prior to assumption in office. So we met these students in school already. But by the time we took over the schools, so it was the struggle to fit into that 75. And some of them said they already paid for these exams, so they were so guaranteed that they were going to move into parts of the 75. Unfortunately, when we came, some of them, of course, were not even qualified. They didn't have WAEC results. The pre-qualification stage, which was supposed to have happened prior to their, immediately they were admitted in school, were not done. So we had to now take our time to do that because that was part of the council requirement. So, it's been resolved. Okay. We have the students in school now. The number of students that are supposed to be taken have been taken, and they're all.
So these other ones were asked to go.
Unfortunately.
So sad. Anyway, we just hope that this kind of thing does not repeat going forward.
We already have students admitted under and of course we didn't make that mistake.
Okay.
There's a guideline, so we have to follow the guidelines, which we have done so far.
Because the fear was that the council not withdraw,
they were at the point of withdrawing that license because ordinarily the students were not even allowed to protest. So that protest was tantamount to withdrawal. So, but upon our intervention of His Excellency, the registrar, responded positively and gave us time to resolve it, and then
Okay. Now, the Association of Nigerian Physicians in the Americas, I understand, are coming for medical outreach in Abia State. What prompted such move?
The efforts we have made so far in healthcare. Yes.
So on their own, they decided to come.
On their own, they decided to come.
Not as if the state government actually invited them.
They reached out to us. They saw what we have done so far, and you know how these things have gone everywhere. People are talking about it. People are actually asking us if they could come and volunteer.
Oh, really?
Yes, from different parts of the world. I mean, I could show you text messages. Every day we receive those messages because they see the efforts, they see our commitments, and they are excited to come and support and give, their best in whatsoever, in any of the areas that we wish them. Some of them said they could come and lecture. As a matter of fact, tomorrow in Amachara we'll have a specialist, an IVF specialist, and in vitro fertilization specialist that will be visiting the Amachara from 2 p.m. tomorrow. And the idea is to see women who are being challenged or who are been waiting to conceive. So they will have them assessed, and it's free. Okay. And it's in collaboration with the Office of Her Excellency and in line with the Women's Week.
Okay.
The International Women's Week, which is tomorrow. So women are, asked to go to Amachara by 2 o'clock. The doctor will be there, and the other doctors will also be there to assess them and see how they can be of help, and what the consultations, the ultrasounds and everything will be done, and then the necessary testings will be done, and then the consultants will be there present to see them. This will happen as often, and this is also because this is free. And this person is doing this in pro bono. We're also going to lecture in the University Teaching Hospital. And this is just all the efforts and all the support we've been receiving from different, both locally and internationally. I've had drugs donated to my office for distribution across the state, and it came to us free. Not a single penny was paid. And these are just efforts that people have made and support they have given to the state so far because of the effort they have seen, so far in the health sector.